Well, all right, everyone. Welcome back to the Dr. Alex Show. And you got just me today. And we had a listener request, funny story. What it was a request from our new staff, Miss Molly. She's amazing, as well as pretty much that same day had a request from a patient who was a listener. So found us on the podcast and then became patient, still listens. And they asked, can you talk about pregnancy? And, it's funny as I'm blessed to say I get busy, I have topics I want to talk about, but then I don't have the creativity to think of what should I talk about within a week coming up to the show. And I texted Dr. Lauren. She didn't have, any creativity on her end. She's like, not sure. I got to think about it. And then lo and behold, Miss Molly, then this patient who was a listener came up with this topic, and it's perfect. It's a fantastic topic to talk about. It should have been discussed even as one of the first few shows, because in my mind, I like to kind of go in a chronological order of things, because when I first think pregnancy, I think we want to have healthy baby, healthy delivery, healthy infant, hit the milestones, and have other reductions of risks to having a child with neurodevelopmental disorders, let alone anything else. So if we're talking about neurodevelopmental disorders, we definitely need to talk about pregnancy, because with pregnancy, I guess let me backtrack. Let's use autism as an example. Few years ago, some of the research would state there's 38, 39, 40 known risk factors for giving birth to a child that will one day be diagnosed with autism. About half of those have to do with the lifestyles of the parents. And within that is how well the pregnancy goes. And it's definitely a touchy topic, because, the last thing I want to do is offend anyone, especially a pregnant mom, or get anyone really worked up and worried about anything. So, a couple rules of engagement. If there's something I say, I would say contact me, Dr. Alex at hmlfunctionalcare.com, for any clarification. And with that, I will do my best to keep everything clear, because again, we're not here to tell you how to parent, how to take care of yourself or your baby. We're all responsible adults. But in the healthcare field, things are controversial. And what we think we know is good for us may not be anywhere near good for us. Otherwise, honestly, why is it that we have this humongous, rapid rise in neurodevelopmental disorders when we can go to third world countries and, for instance, the word autism is completely unknown? Now, they have to worry about things like nutrient deficiencies and clean water and other things that we don't have to worry about in these United States for the most part. But why is it that the CDC is talking about 1 in 32 kids or more that are being born are going to have the diagnosis of autism? And I go to that because that's the most well-known, unfortunately. So just food for thought. But with that, let's talk about this. And I would say I'm going to come at it from a healthy pregnancy standpoint, from a preventative standpoint, for having just the healthiest baby you can have. Now, life happens. We can't always have things be as planned. So it doesn't mean that if 100% of this is planned out from the point of conception forward for you, and things were found out maybe a bit of a surprise, you can still do so much of this, and you'll find out. So with that, if you and your partner, your husband, your wife are thinking about having a baby, one thing I would do is first think about your health. Starts with you. If there are things going on in your health where you could lose a few lbs, you have a new diagnosis of diabetes, there's some mood issues going on, there's tremendous amounts of stress going on in your life, or something along those lines, consider consider getting that under control or managing that better before wanting to conceive and bring a child into the world. And I say that because when it comes to these risk factors of having a kiddo born that can end up having any sort of neurodevelopmental disorder, it starts with the parent's health. And it starts with that epigenetic expression of the parent's health. This is the nature and nurture talk. So epigenetics means upon genetics. And think of your genetics as a blueprint. If you expose a blueprint of your house to a good contractor, i.e. a good environment, clean water, good clean food, healthy exercise, stress management, good emotional and spiritual health, all of that good stuff that we know, then you're going to have a healthy house or a healthier house. Expose that blueprint to a not good contractor, then, i.e. environmental issues are not quite right, then we're not going to have a healthy house. And it is that expression of the read of the blueprint that gets passed down. The good news is that expression can still change. So we can go from not so hot, not so healthy to changes. That's why you can make changes in a child with most neurodevelopmental disorders. Otherwise, I know I wouldn't have a job. So that is very good news. But consider your health first. And it's definitely easier said than done, yes. But consider getting some of your health issues under wraps. If there are things that are lingering under your hood, if you will, with any sort of emotional distress, things that are eating at you from an anger or resentment standpoint, going down the emotional road here real quick. If there are emotional distresses that are day in, day out, if the job is, let's say, a good paying job, but just killer by the end of the day and you're not in a good place, do you think that you're going to be in any better of a place by the time your kid comes around? Answer is no, because like anyone will tell you, when you have kids come around, it only gets busier, it only gets more crazy, and time only speeds up. So with that, I would see about making any sort of change you can make to first take care of yourself, or what I say, put your mask on first, then your kid's mask, to make sure you're in the best of shape. When it comes to the physical well-being, the thing is with America especially, we don't move enough. Even some of those recommendations of take your 10,000 steps a day, that's good, but man, we are meant to move. We need physical exercise, not just 3 days a week or most days of the week that the CDC says. It's every day. Think of exercise as a nutrient. It is a nutrient that your brain and your body needs. The job of the body, the meat suit, is to carry the brain around. Thomas Edison said that. The chief function of the bodies is to carry the brain around. And when you look at it that way, then you might have a different lens of what exercise is. Exercise is great to lose weight because you have to burn the calories to start pulling fat from your system to lose the weight. Sure. But it's a nutrient, a necessary nutrient for the expression of health. And besides that, if you have habits built up, exercise habits built up good habits built up with exercise, emotional, spiritual health, whatever it is for you there, and your child eventually sees that, what do you think they're going to do? I know that I have never shown Kuiper how to do a plank or a push-up or a row or anything in his life necessarily, but he did eventually learn because he sees me work out most days of the week. He might come downstairs and just hang out, snuggle up in a blanket, sit in the corner and wait for me to be done, but he's watching me and he's seeing these habits being built. And that is a good take home for all of you parents currently. If you want to have a child that performs great health habits of any kind or anything, they're watching you consciously and subconsciously. Our brain records everything. So when it comes to the physical piece, that can't be any more or less expressed. When people ask us to go to a baby shower or something like that, I'll check for a stroller to be put on there. And I'm really checking for like an expensive stroller, something that is going to last, because we should make it so that the parents are getting out every day with their child. So not just some measly stroller, like let's get that Bob, the B-O-B strollers that you can jog and walk with. Those are phenomenal. And or something along those lines. Let's get those going because that is going to make it way easier to get the exercise in. And funny story, when it comes to our Bob, we had our Bob for years. I got pictures of Kuiper he was still like 5 or 4 or something like that. And we were rolling around in it because I would go for a jog or a walk and he would just plop in the stroller and we'd go. And it was really funny. We sold it on Facebook Marketplace, had a lady come by and she picks it up and she goes, "Oh, this is gonna be so good. This is perfect stroller for my son. I just adopted. He has autism and I think this would be a great way to kind of keep him busy. And I think he'll enjoy moving and going on the fly and all that good stuff." I was like, "That's awesome." I was like, "Well, hey, if you ever need anything, look us up, let us know, see if you're comfortable with anything we might have to offer to help out your boy." Lo and behold, they became patients and I didn't even realize it because that was like a couple of years later. And the mom was like, "You realize I was the one that bought your stroller?" I was like, "No, I don't remember." But long story short, that kiddo's doing good. Haven't seen him in a little bit because life got busy with them, and I hope that he's still doing well. He's on our radar to get a check on him to see how he's doing. But going back to your health, so we got some emotional things hashed out, some physical things hashed out. Now the big one, food. We've done a show or two about nutrition, and nowadays you can get all this information anywhere and everywhere. But let's keep it simple, stupid. If you know it's healthy, you should be eating it. If you know it's not good for you, then you know you shouldn't be eating it. And with that, a couple guidelines are, my general rules of thumb are start with organic, move to organic sources of food. So for the people that need to be gluten-free or dairy-free, or they're considering it, but they don't know if they should be, start with organic. Make it closer to what was put here on God's green earth, what was grown from the ground or came from an animal, if you will, and nothing more, nothing less. Closer to nature, the better. A good example of that, where it's really become more of a marketing ploy, is the Whole30. It's you are eating nothing but whole foods. There's nothing to it. So with that, as an example, I have this quote healthy prebiotic soda on the table here, and nothing wrong with it. It's a fantastic product, non-GMO, all this good stuff. I don't know that that's necessarily Whole30 approved. Do you need to get into the weeds of all that? No, but no, Whole30 is a good example of what our diets should be. Plants, fruits, veggies, herbs, mushrooms, fish, meats, nuts, and healthy fats, which can come from both forms of meat and plants. And that's about it. The closer to that, the better you're going to be, the better your kiddo's going to be. And the biggest thing, again, would be go organic, go as close to organic as possible. If there's other health concerns that you have where you need to be avoiding certain foods, you'll find that out, or you'll go get tested, or you'll get figured out. That's where great functional medicine practitioners can help you out, or your doctor or otherwise. But it would be organic is the biggest thing to do in this regard. And the other thing I would say is supplements. When it comes to supplements and pregnancy. So if you are looking to be pregnant, or if you are pregnant, there are a few things here. Unless you have some sort of thin blood or bleeding disorder, there is nothing wrong, and it's 100% essential. Take omega-3 fatty acids. We're always deficient in them. It's the healthy fat, if you will. And your baby's brain is going to take up a lot of those from mom, to develop. So if we want to develop a proper functioning brain and also maintain the brain of our mothers, if you will, then we want to have good healthy fats. So fish oil, And not just your 500 to 1,000 milligram on the label dosage. We're talking about let's get 2,000, 3,000 or more milligrams per day of just a supplement. When it comes to supplements, another good one is probiotics. Help feed your microbiota and switch it up. This kind of goes for everyone. You don't want to just take the same probiotic over and over again unless you have some sort of health issue that you've been advised to do that. It's good to switch them up. You need to change up your microbiome, and you need to introduce new probiotics to your microbiome. So switching products, again, organic, but switching to different products, different dosages to essentially help keep a good variety for your microbiome. Another one is vitamin D. Vitamin D is actually not a vitamin, it's a hormone. The 25-hydroxycholecalciferol we talk about is a hormone, so it has a tremendous effect on the body for lots of functions. And taking about 5,000, even up to 10,000 IUs per day for most adults is pretty good. I'd still advise making sure your levels are checked. Yeah, for women, I like to see it around 70 to 80 on your labs. That means you're having the best calcium absorption. For men, about the same would be great, but especially for women in that 70 to 80 range. And then lastly, there's something to be said still about a good multivitamin. And particularly what I like to do is I run a multi, but it is powdered greens and vegetables. So, well, I guess let me backtrack. I have a multi-detoxification powder from old sponsor Apex Energetics called Clearvite. I run that. So that helps with daily detoxification, but it has the whole host of vitamins and minerals in multivitamins. Then I usually will take a powdered down fruits and veggies mix, or powdered greens as they're kind of called. A popular brand, and just as an example, is Athletic Greens. Athletic Greens will sponsor other shows, and it's not an endorsement or anything, but it's an example of a product. Theirs is particularly expensive, but it's a great product, and it has a great nutrient profile. Basically taking fruits, veggies, powdering them down, and then you're getting a lot of the benefit, including some of the fibers of your fruits and vegetables. So you are filling in a lot of gaps in your diet. So from a supplemental standpoint, powdered down fruits and veggies or a good multi, looking at fish oil or omega-3 fatty acids, vitamin D, probiotics. You could argue about some minerals like iodine, a few other things, but that would be a fantastic foundation for anyone looking to be pregnant, and that would go for both mom and dad. Just because mom's doing all the work doesn't mean that the health of that child is dependent on what is given from dad. So if dad is doing the same, that'd be great. Then when it comes to the point of conception and managing pregnancy, so this is where it can get touchy, because especially in the world of being crunchy and holistic, now we start talking about home births or water births or going to a birthing center. And I am obviously 110% all about that. We are meant to have babies through vaginal delivery, and the amazing work that Western medicine does with forceps and with C-sections and everything else is great. It means that babies are coming into this world that we're probably not going to make it otherwise, and possibly have the health of mother jeopardized. So with that aside, going as, quote, all natural as possible is going to be great. This brings up the topic of, are C-sections bad? Is having an epidural bad? Is having forceps bad? It's not that any of this is bad. It's just we're designed to have children in a certain fashion, and that is vaginal delivery. Sorry, but not so much medication or anything else used otherwise. Baby comes in the world. Hopefully it's all over with. Great. Take their first breath, and we move on from delivery. The closer to that, the better chances that the baby's going to be healthy as possible. It does not mean you cannot use those other interventions, and it doesn't mean they're, quote, bad. But when parents come in, for instance, and we have a consultation and their child is on the floor, basically doing unfortunately nothing because they are autistic and they may not even know they're in a new place, for that matter, they'll sit there and they'll ask, well, what did we do to do this? And it's really hard to answer most of the time, but I'll say, I usually come back and I say, there's nothing wrong that you did. You did the best that you could with what you knew at the time. But looking back, hindsight is always 20/20. Could you argue that some of these decisions of medical interventions are not the best for some of these kids? And the answer to that is, unfortunately, yes. But again, does that mean that they're, quote, bad? No. But if you can get to as close of a healthy delivery, quote, natural, normal, quote, delivery as possible, then you are going to have a healthier child with potentially less issues. And some of what I'm speaking of is pretty well written about in terms of the research. Some of it is not so much. And you might hear from your OB about, oh, that's nonsense. But you always have to fire back with the question of, then you show me the research. And I don't have the cool technology to do that on my end currently, but to be able to just simply pull up the paper or papers, but ask your doctor to show you, where is that research that shows that? Or where is it written about that shows that? And it's not because I'm disrespecting these other docs, but sometimes they're so busy and they're already trained to say, like, that has nothing to do with it. They're an obstetrician. Their goal is to deliver that baby, make sure they breathe, and then they're alive and they're out the room. That's what their job is. Their job is to not necessarily worry about, okay, we want to have an all-natural delivery. We don't want to have any interventions of any sorts, and this could be taking a while. No, they have a job to do, and it might have to be sped up. But they are looking out for the health of you and your child. But I hope I'm putting this the right way, having a delivery as close to how we are designed and as close to nature as possible is the first step. And you decide as parents what is right for you. Now, you can have a birth plan in place, as it's called, and it may not go as planned. So you want to have plan A, plan B, plan C, or have a plan of what you're willing to do. So if you want to go into home birth and you want to do a water birth, but then you start having complications at the very end, you need to realize you might be making a trip to the hospital. So then in the hospital, what are you willing and not willing to do? This is where doulas come in handy, or a husband who will 100% be on your side to vouch for what it is that you guys want, and not caving to any sort of pressure if there's no life endangerment. You want to have someone in your court who is going to vouch for what it is that you want and need for you and your child. And that could be a husband who's going to stand tall, or if that is not the right personality and you need your husband simply by your side, or your partner by your side to assist you through the delivery process, then a doula who is trained in doing just that, making sure it happens according to your wants and needs, is going to do that. So then with pregnancy backing up, I kind of jumped the gun. I apologize. This is going to be kind of a funny show, going from talking about taking care of yourself before conception and then going to delivery, talking about pregnancy. Going back to the statement of risk factors and having given birth to a child that could be born with autism, a lot of these risk factors are the health of the parents. But with that, it's also the health of the pregnancy. So when we're talking about the health of mom and dad through the pregnancy, having stress very well managed is a very big part of this. And what we see in office is if we have a family with multiple children and we have children, some children are just fine, and then there's one or two, excuse me, that are not quite fine. It's going to be, oftentimes it's going to be the oldest child. And then later on down, you might see older children are fine, but then it might be the youngest is not quite neurotypical, or they have full-blown autism. And the reason there is because we're talking a lot about distress during pregnancy and distress of mom before and during pregnancy. And this distress is oftentimes going to be what we place upon ourselves, taking care of busy family, all of those needs, running the kids in multiple places, multiple times a day, nonstop for that matter, and any sort of other work distresses and anything else that you want to pile on life. So during pregnancy, this would be a good time to consider starting to say no to your usual things. So if there's volunteering in your life, or there are things that you can 100% take out of your life to replace it with just time for yourself and or your partner or husband, or vice versa, whoever's listening, then go for it, because you want to be able to have as much downtime to make sure you're taking care of yourself. That doesn't mean sitting around, but it does mean downtime to be able to take to yourself, whether it's simply reading a book. Again, I know that means you're sitting still, or getting your exercise in, making sure you're planning out your next stages of pregnancy and delivery, whatever it might be. Whatever you can get off your books and get off your schedule, get it off. And even if it temporarily means while you're pregnant, maybe your older kids don't do as many sports or things. It'll be fine. Just tell them what's going on and negotiate with them, and come up with something creative. Like, you don't need to be running big Johnny all over the place while little Johnny is in the fryer getting baked here. Like, that's not needed. That's so much added distress. Y'all can have way more fun as a family and take a bit of a break from sports and running around for 9 months, 10 months, and get back to it later. Because if it's not the older kids, because with the oldest kiddo, oftentimes as parents, we're already stressed. We're typically, we've just gotten together, or we've all just gotten married, or the child is born out of wedlock, whatever it is. And either way, it can be a surprise, or even if it's not a surprise, we want to be able to have a child, yet we're not always prepared financially. We're not prepared time-wise. We don't have everything lined up. We don't have our baby shower. We don't have all this stuff. So all of that distress is going to get passed down to the kiddo, and that is 100% discussed in the research. But then if you go down the line, so you have 1, 2, 3, 4, 8 kids, whatever it is, get down to the youngest one. Why would the youngest one have autism or something else? That might a lot of that might be because the parents are older, but also it's still a lot of stress. If you got a suburban full of kids and you're running life full tilt all the time, and then you got another one to pile on, that might be the straw that breaks the camel's back in terms of stress loads. So something to consider again would be learning to say no, and talking as a family, making decisions as a family together about, hey, we need to take a load off things. This is what mommy and daddy are doing, or in this regard, daddy and mommy are doing. Again, whoever I'm talking to, this is what we're doing. We're doing a little less here. Where you want to talk to you guys about is maybe we don't do football in the spring, or we don't do basketball this go around, or we don't do 2 sports at once, or the debate club, or whatever it is, just for this little bit. And then we get back to it. Because is that really going to make or break your child in terms of where they're going in life? Probably not. For those of you that have a child prodigy that does something incredible, you already know it. but that's a different topic. For everyone else, I think it's all right. And quite frankly, it could be for the better. You never know what's going to happen after taking time as a family together with yourselves, setting the example of, hey, we have an evening where we're not taking an hour and a half to go to and from this practice or this event. When we come home, we get to go take the stroller out, go take the bob out and go hang out. We get to go to the park, or this is the one evening we can veg out. Let's go turn something on as a family movie night. It'll be great, whatever the situation is. So the name of the game is stress reduction, and bringing it down as much as you can. And this kind of brings up calendar packing. So when it comes to packing your calendar of things to do, it's not only the number of things you do, but it's how tight you pack them. If there's one thing I'm guilty of, it's packing my calendar tight. It's being super tight. Today I was on time to the studio, but oftentimes I'm pushing it because I'm like, oh, I can get done with this patient at this time, then I can get down the road to see Nick in studio 15 minutes later. No, that's stupid. I need to give myself way more time. And I did that deliberately today. I gave myself half hour. So I had a couple moments of breathing after seeing patients for 3-4 hours, and it let my mind set and get ready for the show. Clearly it didn't set enough because I didn't go in order at all, but I think it'll work out. And lastly, with pregnancy, going over all this stuff, what I want to say is, as parents, you are going to know what is best for you and your child. And if there's decisions you're trying to make of, well, we need to be doing this better, we need to be doing the diet better, we need to be getting the exercise better, we need to be able to handle this emotional or spiritual distress better, all of that good stuff. If you are stressing out about it and you are perseverating on it, that is not doing any better. That is just feeding the beast. So that's where you need to shelve it and go back to it. Focus on what you are doing right, and do not create any more distress in your life. So if I say, yeah, go eat organic for all of the mothers that are pregnant right now, that doesn't mean go raid your pantry and come home with a $500 grocery tab of nothing but organic. It means start replacing it at a comfortable pace that you're good with. And when it comes to the exercise, same thing. You're not just going to go blow through a bunch of weightlifting right away today or tomorrow when you haven't done anything in a while. Start slow and start small, because although you're kind of limited on time because we're talking about pregnancy and just the fact that we have 9-10 months of this going on, you want to be able to make the habits lifelong. And if you take your time with it and don't ruin it by going overboard, then it'll be more likely that you'll do it for the long term. And then lastly, with all of it, again, some of this can just kind of get feelings hurt because we're all trying to do our best out here. Work as a team with your spouse or your partner. And I say that because probably the most important thing is, as corny as this sounds, there's nothing more stressful on a couple than having children in your lives. At least I don't think there is. Something that Dr. Lauren and I do is ourselves come first, in terms of we got to look out for number one first in one regard, but we are very unselfish towards each other. I am always thinking about, or I'm trying to always think about, if she ever listens to this, she'll be like, no, you're not. I am always trying to think about her needs first. Yet at the same rate, I need to make sure I'm okay. So for instance, last couple nights, I haven't been sleeping too good. I need to go leave the room and sleep in another room so I can get a good night's rest and figure that out, because I'm not going to wake up and be a grumpopotamus because I'm going to take it out on her. So last night I got up, I just said, I'm not sleeping good. I feel awful. I'm going to go to the other room. She's like, okay. I mean, she's cool because she gets the whole bed and She knows that it just means that I'm not going to bite her head off in the morning because I didn't sleep. So always try to take care of your spouse, yes, and take care of yourself, but you want to be able to do this as a team and as a decision together. So something that we do is if the answer is 2 yeses or 2 nos, it means you move forward. If it's a yes and a no, then you don't do it. It's as simple as that. You talk it out or you shelve it and you come back. What else is there to do? Stop trying to complicate it. So when you're trying to make these decisions for yourselves about increasing your own health and vitality, knowing that you want to be able to have a child in this world, then you need to do it together. And that is going to start setting up the pattern of making decisions for your children together, because it's pretty easy to have a child. And for the parents out there listening, know this. It's pretty easy to have a child come into this world, and then it's basically parent, and then the child is pinned between them. And the parents are having issues because they're trying to take care of the child. I was about to say it's because of the child, but it's not because of the child. It's because they are not taking care of their needs. Therefore, they cannot take care of the child as they both want to. So you want to be able to take care of yourselves. Put your mask on first, if you will. Then make sure you're focused on your kiddo, which means focus on the one that's brewing on the inside also. So doing it together is going to be huge, and not perseverating on things that are stressful is going to be huge. So I hope this show made sense, and I hope you got a lot out of it. It boils down to making sure yourself is taken care of, your spouse is taken care of, making sure you're making decisions together as a team, and keeping it simple to start, and keeping it slow to start in terms of what you need to do to start to take care of yourselves, and then therefore your kiddo. But the biggest things you can do is start with that, because that is going to take a huge burden off your epigenetic expression to have a child come into this world in a much healthier manner. Then those habits are going to actually stick with you the rest of your life, and then you can start setting examples for what is going to be your next number one in your life. So talk to you guys next time.
All right, everyone. The Dr. Alex Show is brought to you by Shed Light Cold Lasers. Shed Light Cold Lasers is, bar none, the biggest thing that has changed our practice at HML. Not only on a professional basis and the results that we are getting with our patients, because for all the professionals out there, everything from veterinarians to medical doctors to everyone in between, you can use this laser in your practice for just about anything. But on a personal basis, because what's unique about this laser is it is handheld. And if you know anything about cold lasers, a lot of times they're big, they're gaudy, you almost have to bolt them to a wall and you can't take them anywhere. This one, you can take anywhere. That's because the diodes are LED, so it runs on really good lithium-ion batteries. And the other awesome feature about this, if you know anything about lasers, is that you can kind of see it on camera there. This laser has red light and infrared light. So we won't go into the details there, but just know that you got all of those features. It also comes preloaded with all of the presets to work on specific organ systems, to work on different areas of the brain, like our specialty at HML, as well as a whole host of other things that you can do with this laser. And to learn more about the lasers, head on over to shedlightcoldlasers.com, 518-338-6658, or you can email Dr. Griswold, or Griswold as I call him, shedlightinformation@gmail.com. And we want to note that you don't have to be a doc to buy these. You can be a patient, someone off the street. And Shedlight specializes in educating professionals, doctors, therapists, as well as lay public people, if you will. If they want to buy a laser, they will completely educate you on how to use it, or they will send you to a doc on the ground, someone like us, to learn how to use it, or they'll just send you to that doctor's office and then you can let the doc take over. Either way, they'll give you all the knowledge and information and resources you need to either get that laser or where to find one in the doc's office.